Welcome to this tutorial for utilization of the Clarus Video System in pre-hospital intubation. We will review basic features of the device and the process by which the device is to be utilized for endotracheal intubation. The Clarus Videoscope is a unique fiber optic semi-rigid stylet. Image is transmitted back through the tip and a light source emits from the tip. The endotracheal tube is placed over the stylet and the image is displayed on the video screen. We will review the basic parts, how to assemble the device, and its use. You will then be given an opportunity for hands-on utilization of the device prior to the trial time study. Basic assembly of this device is relatively simple. Remove the cap used for storage and cleaning. Place the stylet on the main unit. And secure into position. The device swivels utilizing your thumb, as shown here. This is to allow you to be able to keep the screen in view during movement of the device required for proper technique in intubating. To turn on the device, depress the power button and hold until the device turns on. To change from blue tint to red tint, press the button again. To turn off the device, hold the button once again till the device turns off. Endotracheal tubes of different sizes, though appropriate for the patient, are of different lengths as well, and may not fit the stylet without modification. Be sure that the endotracheal tube fits into the hosel. Therefore, you may need to trim the endotracheal tube to the appropriate length. Here you see that the endotracheal tube is too long for the device as the tip is not exposed at the very end. This will obscure your view. Simply remove the top of the endotracheal tube, trim the ET tube back to the appropriate length, typically just beyond 29 centimeters, and then replace the top of the endotracheal tube and slide it onto the stylet. Now check position, and it's noted that the stylet is not protruding but is at the end of the endotracheal tube, allowing for a view as shown. Assembly of the Clarus Video System is not difficult, as shown before. When preparing for use, you will need to assemble the device. First, ensure that the endotracheal tube fits easily over the stylet and that it is the appropriate length. If it is not the appropriate length as displayed here, you will have to modify the endotracheal tube. Remove the tube from the stylet, take the top off the tube, estimate the appropriate distance, typically just beyond the 29 centimeter mark, replace the top of the endotracheal tube, then place the endotracheal tube back on the stylet and ensure that the tip is protruding from the end of the endotracheal tube but not beyond the tip of the ET tube. This will allow for appropriate and safe viewing through the device. Remove the storage cap, place the stylet onto the main device, and secure into position. The device is now ready to use and may be turned on, video checked, swivel checked, and be put into use. After lubricating the device with a thin layer of Surgilube, place the endotracheal tube on the stylet and set into the tube stop. Test the optics and light, perform a jaw thrust, place the CVS with endotracheal tube in the mouth at the midline and slide past the tongue. You will then visualize the epiglottis. It is important to follow the airway as you go in. First you will see the uvula and tongue, then the epiglottis. You will proceed under the epiglottis. You will first see the arytenoid cartilage, and then clearly will identify the cords and the trachea. Then proceed through the cords with the device. Once through the cords, slide the endotracheal tube off the stylet through the cords and inflate the balloon. You may need to tilt the screen in order to keep the airway in view during this procedure. please become familiar with this facet of the device. Remember that the procedure is to pass the stylet with the endotracheal tube through the cords. Slide the endotracheal tube through the cords into the trachea and watch the balloon pass the cords. Then inflate the balloon and carefully maneuver the stylet while holding the endotracheal tube firmly. Confirm tube placement with the device and secure the endotracheal tube into place. The balloon passing the cords is seen here, and you can see that the EVES provider can see this clearly on the device during the procedure. A successful intubation can then be confirmed with the device as you re-enter the mouth after intubation and is seen here as a successful intubation. An esophageal intubation can also easily be identified and is shown here. This patient requires re-intubation. Go midline, follow the airway, visualize the cords, pass through the cords, slide the tube into the trachea, inflate the balloon, and lay the instrument down. Then re-enter the mouth and check position. Once again, go midline, follow the airway, under the epiglottis, there's the arytenoids, through the cords, pass the endotracheal tube into the trachea, inflate the balloon, and lay the device flat to remove. Re-enter the mouth and confirm successful intubation. Then secure the tube. The Clarus Video Scope may optionally be utilized along with a laryngoscope. Utilizing a Macintosh blade, sweep the tongue, lift the mandible, place the CVS midline, and utilize the system just as you would if you did not utilize the laryngoscope. Remember to inflate the balloon, remove the device, and check placement. Please review the steps required for intubation with the Clarus Video System and participate in the precepted hands-on experience. Then you will be asked to participate in the timed portion of the study. Please remember that it is important to attempt first pass success. As with intubation in a real patient, first time success is more important than overall speed. Please take your time to appropriately utilize the device and attempt first pass success with both the device and when utilizing direct laryngoscopy. You will now be given hands-on instruction and several attempts to intubate with the CVS on the mannequin prior to time data collection. Please feel free to ask questions, and thank you very much for your participation.